Seeing your primary care doctor or going to the hospital comes with a cost. So what is covered by your health insurance and what isn't? 22 News I-Team reporter Mike Mascadrelli tonight looking into healthcare costs during the pandemic and what's driving prices higher.
In the event you have a medical emergency or even a routine procedure done, you could be left paying a lot of money out of pocket, even with health insurance.
The cost of health care has just gone up and up and up. There's seems to be no end in sight.
Medical bills can be very expensive, and that could be even with insurance.
As of right now, I have a $920 CAT scan running over my head for a simple screening thing that my primary care doctor ordered. That just doesn't seem right.
Kristen was born with a rare immune disease called CVID. Her primary care doctor recommended that she get a CAT scan of her lungs done, something Kristen would later find out her insurance would not cover since the hospital termed it routine. This was with diagnostic services written into her health insurance plan.
This is not surprising at all to me, and I will fight it till the end. I've fought every single time they've done something, I fight it, but it takes a toll on you. Like I have extreme anxiety when I get these bills. Oh my gosh, because I'm unemployed periodically because of my illness. So it's not possible to pay these amounts.
Dr. Paul Salva, a pulmonologist in Springfield, knows of patients being mailed bills they can't afford, especially with the emergency room.
We see reports every day about people going in for what seems like a routine thing, and they're getting a bill for several $1,000s. And you're like, how did that happen? Well, you went to the emergency room.
Now, you should really do your own research since your health insurance plan could be vastly different from someone else's. An X-ray or MRI in the emergency room could easily exceed your deductible depending on your coverage. Another expensive part of healthcare is just getting to the hospital.
Taking an ambulance could cost you hundreds of dollars. But the 22 News I-Team learned these things still aren't the biggest cost when it comes to healthcare.
Pharmaceutical costs are astronomical. I have a company right now that they're paying out $18,000 for one drug on a monthly basis for one employee.
Steve Corbin is the employee benefits manager at Dowd Agencies.
One of the biggest contributors to continuing high cost claims. Again, I mean, the companies, the pharmaceutical companies out there, they're creating these new medications that are keeping people alive, right? So, I mean, people are living with illnesses that would have killed them historically. But there's a cost associated with that.
He said it's a factor that's having a direct correlation with higher health insurance premiums and deductibles.
As the cost of care continues to rise, the health insurance companies really don't have many tools to bring that down, nor do I think that sometimes they have a true desire to bring down the cost of care. You know, some of these executives are actually incentivized to have those costs go up, right? If the only way for them to get a raise is for the cost of care to go up, I mean, what decision do you think they're going to make?
Corbin told the I-Team they're also taking into account all the people putting off non-emergency procedures and health issues not related to COVID-19, a troubling trend in the health community.
It seems that if people develop symptoms and it turns out to not be COVID, it's kind of dismissed. Well, no, there's something going on, and all the illnesses that were in our lives before this are still there.
And that right there was Mike Mascadrelli reporting. Medical experts suggest asking for an itemized bill to see exactly what you're being charged for in each part of the procedure, even the visit. Then checking to make sure that your insurance was billed correctly.